Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Today we have lecture about the child abuse. Is it important, child abuse? Yes, it's not uncommon problem in our society. So, what are types of child abuse? Maybe physical, like non-accidental injury or neglect, maybe emotional abuse or sexual abuse, non-accidental poisoning or fabricated or induced illness, what we call it Munchausen syndrome by proxy, and maybe combination of several forms.
واصل ما مشكلة كل
Physical abuse. It's essential to understand how the injuries occurred and the circumstances surrounding the event. Some clues in history guide you to the child abuse. That history not compatible with the injury and sometimes delay in reporting the injury. Happened, for example, for 3 days back and they come today. Inconsistent histories from caregivers. History of recurrent injuries. Happened many times before. Injuries inconsistent with the child's stage of development, or inappropriate reaction of parent or caregiver, like vague reaction, maybe unconcerned or excessively aggressive. What's the presentation of physical abuse? Any of these forms: bruises or non-accidental head injury, sometimes abdominal injury, burn or scalds, or fractures. We will pass by all of these. Bruises. This is the commonest mode of presentation, and on the face, back, or buttocks, but uncommon in genuine accidents. Little evidence that bruises can be accurately aged. Sometimes very difficult to give accurate age for this bruises. How old? Why these bruises suggestive of particular injury? Maybe bruises around mouth. The abuser tried to stop baby crying. Sometimes bruises on the arms from shaking. Fingertips gripping on trunk on either side of the spine. Other form, slap marks resembling handprints on the face or buttock. Bruises also may outline particular object, like hand, belt. Here you see bruises behind the ear. This one, what do you see in this picture? Torn frenulum, because maybe caregiver push the teeth to stop crying the baby. See here. Here, this is the torn frenulum. By the way, not all bruises look like child abuse. Here, multiple Mongolian spots, so don't be confused with this one. It's in the back, but it's Mongolian spots. Here, is it clear, this picture? what do you see here in this picture? Not all bruises due to child abuse. Here we have multiple area of hyperpigmentation, hyperpigmented areas. This is post-inflammatory. Post-inflammatory. It's pigmentation. See? Before it was insect bite, inflamed, and this is hyperpigmentation. Also, what do you think this picture? These are multiple petechial rash. Petechial rash. So, with history of viral upper respiratory tract infection, this is mostly idiopathic thrombocytopenic purpura. We try to push on to check the rash. Doesn't fade on pressure. When we suspect idiopathic thrombocytopenic purpura, we check full blood count. It comes normal leukocytic count, normal hemoglobin level, but low platelet level, isolated thrombocytopenia. Other than another form, other than bruises, non-accidental head injury. It may follow severe shaking, but less often direct blows to the head. If severe shaking, maybe hypoxic ischemic damage and apnea. There may be underlying skull fracture. So, what's the clinical picture of non-accidental head injury? The child looks irritable.
معلش يا دكتور من الصورة اللي
فاتت
دي؟
دي؟
لا
اللي قبلها؟
ايوه من دي معلش
أول مرة تاني؟
ايوه
لما بتيجي بقى تعمل أنت مونتاج
بعدين بشيل
بس بيقطع برضه معلش
يلا بسم الله.
So what do you see in this picture? Multiple black area here. So not always due to child abuse. Here this patient post-inflammatory hyperpigmentation. Reason was insect bite. So don't be confused. Here another picture. What do you see here? Small, multiple, petechial rash. When we check this rash, it doesn't fade on pressure. If you have history, viral upper respiratory tract infection, this patient has idiopathic thrombocytopenic purpura, and when we check full blood count, normal white blood cell, normal hemoglobin level, but low platelet count, thrombocytopenia, comes with diagnosis of idiopathic thrombocytopenic purpura. Other than bruises, another form of child physical abuse, non-accidental head injury, may follow severe shaking, less often direct blows to the head. If severe shaking, may be hypoxic ischemic damage and apnea. There may be no bruising on the surface of skull. Ophthalmology examination very important because retinal hemorrhage often present in non-accidental head injury. Also, there may be underlying skull fracture. What's the clinical picture of non-accidental head injury? Child looks irritable, with poor feeling, anemic, pale, and DB convulsion. Head examination, full fontanelle. If you are following, there is increasing head circumference and maybe impaired consciousness level. This picture, computerized tomography of the head of child who had non-accidental head injury. You see here diffuse hypodense area of the brain due to hypoxia. So hypoxic ischemic injury with its sequelae. Here, what we see here, this is also computerized tomography head, and there is dark rim here. This is trauma. This is subdural hemorrhage. Yes, subdural hemorrhage. Here, this picture, you see cerebral edema, extensive cerebral edema. If you see ventricles very compressed, and at the same time there is no gray-white matter differentiation because of cerebral edema. As we mentioned, ophthalmology consultation very important for endoscopy. You see here multiple retinal hemorrhage with baby shaking syndrome. Okay. Another form of physical child abuse, abdominal injuries. Abdominal injuries, visceral injuries to small bowel, spleen, or liver may follow blows to the abdomen or kicks to the abdomen. Also may not be abdominal bruises. Usually under 5 years of age, trauma carries a high morbidity and mortality. It's uncommon and often difficult to diagnose. Burns. Often difficult to distinguish burn inflicted accidental from non-accidental. In accidental burn, it's asymmetrical, spares the flexures, and have geographic splash marks. Deliberate path scales may scald the back. Shape of injury may suggest its etiology, and cigarette burn. We'll see here examples for this one. Here, what do we see? We see here this look like rash, it's deep, the same. So this burn caused by heated cigarette lighter wheel. Yes. So it gives idea about the etiology, shape of the burn. Here, another example. This is a recent cigarette burn. You see here vesicles here bunched out in the center. After some time, start granulation here, and when it becomes old, here you see full thickness punched out scar. This was healed already, cigarette burn. So sometimes when patient come for we suspect child abuse, we may see old injury like this. On the other side, this is called accidental scalp. Accidental scalp, not we don't consider it as child abuse. It's accidental scalp. Here